Hi, I wanted to go over on typing a Transitional Services of Iowa comprehensive mental health assessment. This tutorial is especially for the clinicians on how to type them, but there might be mental health technicians out there that we utilize for typing these assessments, and this is a learning tool for you. But if you are one of the providers or therapist, BHIS workers that's interested to know what goes into specific elements of an assessment, please feel free to watch this tutorial. So what we have is the template, and every template for every comprehensive assessment is the same. This is the overall assessment that is completed for anybody coming in for a service besides substance abuse evaluations. That is a separate component, but we can include that in here. We start with a comprehensive assessment. What you're going to want to do at first is get all the specific demographic information: name, date of birth, telephone number, age, gender, legal status, and school, referral source, guardianship, which is the parent's name, and any cultural needs the family may have. At the very top, we're going to get the name, Medicaid number, and the Social Security number. If you do not have the Social Security number, please put how you're going to obtain that number and try to contact the intake provider to see if they have the number. The comments is going to be just a little bit about your experience on getting and who participated and how long it took. So you're going to want to put what assessment sequence this is: the initial assessment, second assessment, continued service review, and then how long they've had services, who was all present for the assessment, how many minutes that it took, and what tools were used during the assessment. And also that's going to be your Vanderbilt and your CHI. Also in the intake packet was completed and signed releases to the following agencies. Then you're going to want your family. This is everybody who's living in the family, and we have their date of birth, their gender, relationship, and living. Sometimes at the bottom I'll put significant other household members, and this could be like if they're staying with a relative right now, or if they are have two houses, such as a blended families often do. We want to make sure that we get the emergency contact. We need name, date of birth, and address. If this is something different from the releases, make sure that you have a release for the emergency contact. Also, you're going to want to get their primary physician's information, and that is going to be their family doctor. And on the next page, you're going to also want to, this is where you're going to start with the precipitating events. That is how and why did they get involved in services, what led up to the services. And then you have your behavior indicators. What are the exact behaviors that you're seeing with the client? You're going to be able to pull some of these behavior indicators from your Vanderbilt or your other tools, screenings that you use in the assessment. And then why are they seeing the clinician here? What do they see as your problem areas and events? That all goes into that one section. Just make sure there's clear distinction between your precipitating events, your problem behaviors, and your and those areas. So the actual clinical assessment, though, is everything that you've gathered that you're making your clinical judgment on. So you're going to have the child's age, marital status, race, sexuality, where they attend school, what grade they're in. A little bit about the mother's the mother's pregnancy and delivery with the child, and any neuromuscular, developmental, and motor milestones will be answered, and overall temperament and developmental delays. This is all answered on page 2, the next section right underneath your clinical assessment. Then you want to talk a little bit about the background of the family. This is, the mother, the father, the siblings, what, where are they at in the sibling, where are they born and raised, information, did the parents graduate from high school, are they employed, why aren't they employed, do they have any legal issues, health issues, medical issues, substance abuse issues, mental health issues themselves. All that goes right into that clinical assessment. That is the family background. Integrate your information together. You don't have to, have it cut and dried. It's more of a narrative form when you read this. Then we want to know if there's ever been any child protective services currently or in the past. And if so, just specify what that, when and why they're involved. Try to ask questions, though, to gather that information and make the follow-up questions to get as much as you can so you get a clear picture from the interview. And you're going to want to put any significant events in the last 6 months to a year that have impacted the child's well-being. Sometimes if you have to go farther back, like if there was a suicide or a death in the family that severely impacted, you can use those as well. Now you're going to want to talk about your current living situation. Are they homeless, adequate housing, dependent on others, who all lives in the house, overcrowding, any sort of their living conditions, if they're employed, not employed. And then we're going to go to the strengths of the family. This is going to be supports and strengths such as therapy, medication, extracurricular activities, church, 4-H, big brothers, big sisters, band, Girl Scouts, Cub Scouts, support groups, waiver services, anything that they're involved with. Get information on community activities, hobbies, church and military, and go ahead and put that also into this section of the report. When you're putting in the legal system, what we're talking about here is parole, probation, pending charges, past charges. Oftentimes I'm seeing clinicians put no limitation barriers. Then why are you here? If there are no limitations to the family, then why are you here? Oftentimes these families are here because there are some type of barriers such as inadequate housing, IEPs, family discord, transportation issues, divorce, death, CPS, peer relationship. There's limitations a lot of times with these families, limited resources, poverty, overcrowded housing, language barriers, just all different kinds of stuff. So be open when you're thinking about what your limitations and your environmental stressors are for this area. Those are all you can combine together. Limitations, barriers to services, environmental stressors are all pretty much the same thing, just a different way of asking. So think about that whole paragraph as those situations. When we're going to academics, you want to put if they're regular education, if they have an IEP, how long they've had an IEP, what is their involvement in school, what are the behaviors in school, what is their attendance like, are they of intellectual or normal functioning, above range, average range, and also a little bit about how they react to peers. Anything else that is situated with school, such as suspensions, referrals, that information needs to be in your academic section. What I provided here is the outline, the questions that I want answered, but you can always add more to the to that section. When we're talking about medical history, that's the child's medical health. I gave examples: chickenpox, measles, ear infections, mumps, asthma, lead poisoning, anything that the child might have had up to this time in the back. Then you put if they have medical issues or not, their current physical health, and any medications, allergies the client might have. When we are putting down what medications they are on, you need to put the dose, the frequency, start and date, who's prescribed by, and why they are receiving that medication. Underneath that, if they need to put if they were educated on their medication. This does not mean that you educate them on their medication, but that somebody or their doctor has provided them education on their medication. We need to put whether they have visual impairments, hearing impairments, or a disability, difficulty with like writing, walking, moving certain limbs. Then we're going to want to put the family medical history below that. The next section is we're going to have our substance abuse, and you'll find there's a certain specific outline for that. We need to admit or deny to the alcohol, amphetamines, prescription drugs, nicotine, and caffeine. Those are the ones that have to be present. So when you're looking at those, think of cigarettes and coffee or pop. And if they do have coffee or pop, then you need to put how often. Occasionally, daily, moderate use, within normal limits, whatever you think needs to be answered. But if they usually are having coffee or pops, so make sure that you look at that one. And then we're going to want, if they deny or admit a substance abuse history, any of their patterns, any of those issues regarding substance abuse, and if there are significant issues, then we're going to look at what we need to do as a next step when we get down to treatment planning and recommendations, which will be another segment. Mental health, we need to talk about when they got therapy, where they got therapy, how long they got therapy, and if it was beneficial. And also, anybody who has therapy in their household. We need to report whether or not they have a psychiatric directive at this time, and if there is any psychotropic medication history with their family members, such as ADHD, bipolar, any kind of medication that deals with emotional, mental health, or behavioral health issues of their family members. Next, you're going to want to report your hospitalizations. That's going to be inpatient or outpatient. For emotional or mental health issues or behavioral issues, that's going to be first for the client and then for the family. So you want to make sure that you have that information included in this part. The question needs to be there. You can put admit or denies for each question, but it needs to be listed in your assessment. Then we're going to have a history of the patient's behavioral indications or mental health issues such as eating disorder, sleep disorder, physical trauma, those sorts of mental health issues. And then we're going to list whether or not your patient is motivation for change, if it's positive, minimal, questionable, and if so, why. There needs to be a reason on why we need the services in the home or in the school, and if the patient accepts the need for treatment. The main problem appears to be in the home or school, and the reason why. And client needs support to stay on track and make some positive choices. So we just need a little bit about motivation regarding there. Then we're going to have your functional assessment, and your risk assessment is going to be completed next, and I will have that in a different segment about how to fill out those areas, as well as a mental health status exam. Right now, all those, you can just watch the follow-up. Those areas need to be included in this. And then we have summary and recommendations on the back of the assessment, and that will be in the next segment. But I want to make sure that when you're gathering this information, you're very clear, concise, and always remember to ask follow-up questions. If they say, yeah, they had a bad time in school, I want you to ask, why? Give me an example. So the follow-up questions are going to give you more detail on your client, and that's going to help you make a better recommendations and a better idea of what's going on and what's going to be best for your client. You can't just take everything at face value. You need to do some investigative work and some really good interviewing skills. Okay, well, that's the basics of a comprehensive mental health assessment, and stay tuned and I will go over some of the sections in more detail. Thanks. Bye.